Join me today on GHC Coffee Break. It's Dental Hygiene Month for October. Get your coffee. We'll be right back.
Your life is filled with opportunities to show the world you can take charge. It's waking up each day with a mission. It's working each day toward a goal. It's choosing to rise. It's charging forward with a purpose. It's changing the course of your life and taking charge of your future. If you're ready to be a Take Charger, enroll at Georgia Highlands College today.
Welcome to GHC Coffee Break. I'm very excited today to have my guest, colleagues, friends, new friend, Kristen. They are Michelle and Kristen from Georgia Highlands College in the Dental Hygiene program. Mm-hmm. October is Dental Hygiene Month, which is always exciting. I always have to take my hats off to dental hygienists, dentists, anybody that fools around with the mouth, and when they see me coming, they go, oh God, she's coming. Get the gas. Because I am the big chicken, even to do, literally even to do my teeth cleaning, I almost want them to give me the gas. I don't know what it is, just don't get around my mouth. I don't know, I can't explain it. I know it's a big baby, and they're probably going, oh my God. You didn't know that about me, Michelle. Sorry. But yeah, big chicken.
And we love to get our teeth cleaned.
Yeah. Now, after it's over with, I love it, and I'm glad. Getting teeth cleaned, yeah, but anything else beyond that, I'm finally over the whole, I like getting my teeth cleaned, which is actually time. Put that in my little mental note. But so I'm going to just kind of hand it over to you because you're the experts on not only the rationale, but the benefits of regular teeth cleaning, especially from a hygienist standpoint.
Mm-hmm. Well, October is National Dental Hygiene Month, and so it's the month that we celebrate our profession, dental hygienist, and also the importance of good oral hygiene and keeping a healthy mouth. And so we as hygienists are the prevention specialists basically of the dental office. So we do so many things besides just cleanings.
And I think that's important to know too, that a lot of us out there, and I'm probably one of them, that have a lot of ignorance towards that. Mm-hmm. It's not that we're stupid, we just don't know the information.
Exactly. So Kristen and I were talking about this just before we got here, and over 50% of the U.S. population has periodontal disease.
And explain to people what periodontal disease is.
Periodontal disease is loss of bone and tissue around the tooth structure. There's different forms of periodontal disease. There's actually a higher percent that have earlier stages of periodontal disease. So gingivitis is actually a stage of periodontal disease. Okay. But it's the only reversible stage. And so seeing your hygienist regularly is very important because they work on the education, cleaning, and doing education and oral hygiene instruction on how to keep your mouth healthy.
Okay, so that's, and growing up, it was just what we did. I'm going to show my age now. Get over it. 59 years old. Growing up, my thing was we brushed our teeth in the morning and at night if we thought about it during the middle of the day after eating. I'll just be honest, that's what we grew up with. Mm-hmm. It wasn't until older and in school and different things that, it became more aware of the other things like the flossing. I don't even know if I don't think flossing was around when I was growing up. Or if it was, I didn't know about it.
Right.
How important even flossing is, I definitely didn't know. So is those things
extremely important? So definitely brushing your teeth twice a day at a minimum is what we recommend. But flossing or using some kind of interproximal cleaning tool to get in between the teeth.
Okay.
Because the toothbrush can only reach the fronts, the tops, the backs, and partially in between, but you have contacts in between the teeth, mm-hmm. and bacteria sits in between, and so how do you get that out?
Right.
So the floss, and then there's other tools that can be used as well. So flossing is not the only way to remove that bacteria that's in between the teeth, but it's the most highly recommended. And definitely floss at least once a day.
Okay.
And so you can remove that bacteria that's in between the teeth, because it not only causes some bone loss, but it can also cause cavities, the bacteria sitting in between your teeth, because that's where a lot of the decay starts, is in between the teeth.
Now, toothbrush, since you mentioned that your toothbrush can only get to certain places, is there a specific recommendation that you guys have for, and I know each dentist our dental hygienist at a specific office may have their own recommendation, but you're sitting in front of us, so what do you recommend, or is there a specific?
We recommend a soft toothbrush, soft or extra soft,
I've always
to
used
not be so
mild.
abrasive on the teeth. And a lot of the general population prefers a hard or medium toothbrush because they want to feel like they're doing a good job. But we do recommend soft or extra soft. But I think bottom line is, whatever your personal preference is, whatever you're going to use is better than nothing
True.
at all. But to preserve the tooth structure, soft and extra soft is better.
What about head size,
Small,
type?
small, to make sure that it fits. You want to make sure that you can reach every area of the mouth. And if you choose a toothbrush that has a larger head on it, then it makes it more difficult to reach all areas.
And electric, non-electric?
I prefer electric. I do use an electric toothbrush, and I think it reaches areas of the mouth better. And if you notice, even on the electric toothbrushes, they have a smaller head on them.
Yes.
And the idea of that is so that you can reach every area of the mouth, similarly to the way your dental hygienist does when you're in the dental office.
Yeah, I just recently bought and it's got a small round head, an electric one. I've always used just a regular manual. I won't go brand name, so just a regular manual toothbrush. Usually been medium to firm, actually. So that I didn't think about the soft.
One thing I like to point out about a soft toothbrush is the toothbrush is not only supposed to brush your teeth, but also slightly below your gums. And so I equate it kind of like a wire bristle. And so if you're trying to clean the rims on your car, and you're using something that's really, really hard, it's not going to get into all the nooks and crannies.
Okay.
And so a softer toothbrush is going to flare a little bit, and so it can get slightly below the gums. And then with a smaller toothbrush, you should only be brushing 1 to 2 teeth at a time, because you're trying to put an angulation that it's getting in between and molding to the tooth as you go. And so it's important to use that smaller smaller head and a soft toothbrush. And you just said that you just bought a new electric toothbrush. I would definitely take that with you when you go to your hygienist at your next visit and have her demonstrate, because there are so many different types of electric toothbrushes, and based on the head and the functionality of the toothbrush, there's certain ways that you're supposed to brush with an electric toothbrush.
That's interesting.
There is a common misconception, and because most people were raised and started brushing using a manual toothbrush, and you have to do all the work with a manual toothbrush.
Correct.
But most of the electric toothbrushes are designed to do the work for you. So if you try to use an electric toothbrush just like you do a manual toothbrush, you kind of counteract its design. So
Yeah, I probably
your dental
do.
hygienist can actually, obviously show you how to use whichever toothbrush it was that you purchased to make sure that you're being most effective with it.
Well, that's great. I do these programs not just for you guys out there, but also for myself. Let's be real. Because even though I do take care of my teeth, I probably don't. I am getting older, so I know. And I look at my mom, who is 20 years older than I am, and I definitely see. And I don't know if it's. I try to remind her. I don't know that she's taking, especially with diabetes, as good a care as she should. And with me having type 2 diabetes now, I want to make sure that I am taking care of it now, so that in 20 years from now, I'm not having the same issues that she's having. And I have lost some teeth, I'm sure, because of.
Well, you make a very great point, is you have systemic condition, diabetes. And there is a direct correlation between oral health and diabetes. And so your HA1C can be higher if you have active disease process going on in your mouth, and vice versa. So they work hand in hand. And so there is that direct correlation and direct link to the oral systemic link, so different systemic diseases. So it can affect your heart, your kidneys, your liver. So it's very important to have these conversations with your hygienist or your dentist and talk about the different health conditions that you have, because they might have some different recommendations, or they might say, you know, you need to come in and get your teeth cleaned more frequently because of your systemic condition.
Okay, that's also something probably a lot of people didn't realize as well, because again, you know, things that you just don't think about until you're faced with them, and you see it maybe either in a family member or yourself.
You're right.
Before it's too late.
Right.
And that's part of what you guys do too, is you go out into the community and also have people come in here, I believe.
Absolutely.
We do. Georgia Dental Hygiene students, we volunteer throughout the community, Bartow County, Floyd County. This year alone, we have partnered with Bartow Give a Kid a Chance, where our students did oral screenings to determine whether children had active carious lesions or dental decay, so that they could start school. We also partnered with Bless Weekend to do oral cancer screenings for some of the Bartow County members, and we did the health initiative for men and women in collaboration with the Floyd County Health Department, providing oral cancer screenings for Floyd County residents.
And I think a lot of times people associate oral cancer with either tobacco use, stuff like that, but that's not necessarily the only cause of oral cancer, I'm assuming.
No, the higher percent of people that are getting oral cancer now is related to the human papillomavirus.
Oh.
And so, yeah. So that's something that we as hygienists do. So when you come in to get your teeth cleaned, you will be getting an oral cancer screening. They're always looking in the back of your throat, under your tongue, in your cheeks, feeling around your head, your throat. So that's one of the things that we do as well as part of our...
It's part of our training. Our students are definitely trained to provide a thorough oral cancer screening and to be able to recognize the red flags and the signs and symptoms, early signs and symptoms, because that's what our goal is to diagnose and recognize early. The earlier we can recognize oral cancer, the better the prognosis is for the patient.
See, and I definitely don't think most people out there realize that this is what, the extensive care that the dental hygienist operates under.
I think the dental hygienist, we have such a wealth of knowledge, and sometimes it's unrecognized and uncelebrated. But a lot of that is because when we're doing what we're trained to do, we don't really verbalize it. So most dental hygienists out there, exercise their knowledge on a daily basis and use that knowledge, but yet don't really talk about what we're doing, unless unfortunately there's something that we need to talk about. So when there's something that's noticed as a red flag, we will speak up and say it, but a lot of times it's just routine and we do it so frequently we forget to verbalize it.
That's what's actually going on.
Right.
That's a good point.
Right.
And one of the things I want to point out is, since we're talking about oral cancer, is even people with full dentures should be going in regularly, at least annually, to get an oral cancer screening, to check to see if their dentures are fitting well, to see if there's any pain, if there's any areas that are causing pain or problems, but also to get that oral cancer screening. And so they think, oh, I don't have any teeth, so I don't need to go.
Right.
But they still should be going as well.
Yeah, that's a really good point, because I don't know how many of us would have thought about that either. I hope to keep my teeth while longer, but you never know.
Right.
All right. Well, we only have a couple of seconds in this segment, so we'll be right back. Go get your coffee and join me on GHC Coffee Break.
Open road, here comes the Heffley family.
Whether it's a short trip or a long haul,
Estimated time 47 hours.
they will beg,
You're hungry? I'm happy to provide.
they will plead.
Deep fried butter on a stick.
But whatever you do, don't wimp out.
Now you're talking?
Make them buckle up.
He can't hurt.
Remember, safety first. Cheese curls second.
Are you orange?
Welcome back to GHC Coffee Break. I don't know about you, but I am learning a lot. As I was saying during the break, I go for my regular have to visit. I'm a big chicken. What can I say? The dentist sees me coming and they say, "Here she comes, get the gas." Just saying. But for the teeth cleaning, I do actually enjoy that, and I like to, lick my teeth forever after it's over because it feels so good. But never really realizing what all does go on during my hygienic moments when they're, which I hate the X-rays because I don't care what they do. They have not found a south mouth X-ray palette to take. I always end up with these little scars in my gums for it seems like forever. But work on that. That's your new invention, Michelle. Invent a new way to make it not hurt when you get X-rays. But just other than getting the X-rays, cleaning the teeth, and you got a little gum bleeding here. You need to make sure you're getting a little bit better with your flossing. The education is always there, but not as in depth unless, like you said, there's something going on. Mm-hmm. So I think that really is important that we become more aware of it. And that was one of the reasons why I've been really anxious to have you guys on here. When I saw October, I said, perfect, good timing. But I know Georgia Highlands College does a lot, not only for the community, you were telling some of the things that you've already done, but also at your Heritage Hall location. There's a lot of things that y'all do here as well. So tell us a little bit about that.
So we have a dental hygiene program, and so we actually have a functioning clinic that the general public can come to. And so we provide regular cleanings, periodontal cleanings, exams, x-rays, fluoride, sealants, and for a reasonable cost. And we do it on all ages, from children all the way to the geriatric population. And it's a little bit different than when you go to your regular dentist because it is an educational setting. And so the students are being trained. And so when they do an exam, and then the hygienist faculty member will come and check behind them to make sure that they're doing what they're supposed to be doing along the way. And we have a dentist that looks at all the x-rays, and then does the diagnosis based on what they see on the x-rays. So we have a fully functioning clinic, and we have 10 students that work in the clinic at least 2 to 3 days a week.
Oh, okay.
So, do you want to add anything?
I just want to say, I think it's interesting what you first said is how fearful you are of going to the dentist. And I think that's one of the motivating factors to be a dental hygienist, actually. That's one of the things that motivates me, is that I know on a daily basis as a dental hygienist, I feel like I have the ability to change the world one person at a time.
Oh,
and
I love that. That's my favorite saying.
to change their overall health and to contribute to the community's overall health through all the community involvement. But the patient like you that starts off as fearful and then they return, that's the ultimate reward, really. When you have someone that is fearful to come to the dentist, but yet they still come back to see you, and that's what keeps you motivated to continue on to be a dental hygienist. And one of the things that I think all dental hygienists are proud to call themselves dental hygienists. You know, we're a close-knit community. Even though we're diversified in who we are, we're still one community and one profession, and health professionals that it's you know, it's a proud moment to be. But to be able to work in the clinic and see the students learn on a daily basis is rewarding in and of itself. But yeah.
I think the part of the patients that are fearful coming back, not only do they come back, but they come back with a smile and a hug.
Yeah, they do. They do.
Because you've relieved some of their fears. And one of the things that I always tell my patients that come in and they're so fearful, they're like, I'm so afraid of the dentist. And I say, well, I'm a dental hygienist.
You don't have to be afraid of me because I'm not a dentist. And I think that's what makes, you know, dental hygiene unique, is you have an opportunity to not only one-on-one be with a person, you can have a relationship and build relationships with an individual and watch them grow from childhood to adulthood. And I mean, I've been fortunate enough in my private practice. I've been a dental hygienist for over 14 years now, worked as an instructor at Georgia Highlands, and I mean, I've traveled vicariously through patients to Germany and Honduras and Italy and, you know, France and all over the world, and hiked the Continental Divide with a family. And it's very rewarding to be able to do that and build those relationships as a dental hygienist. And I think that's what.
So you're making me smile.
That's our job.
Right.
That's our job, right? To make you smile.
Because I'm in human services, and what you're saying about your profession and dental hygiene is the way I feel about our human services, and how you smile when you talk about it is how I feel when I talk about my field. So that's exciting to see that.
Yeah, it is.
So.
And it's exciting to watch the students enjoy that as well. To watch them grow and thrive in that environment and build that passion for the profession that you're passionate about.
Absolutely.
So, yeah.
One thing about our dental hygiene program is we are an associate degree program, and it is also, as a hygienist, you are a licensed professional. And so I wanted to get that knowledge out there, because I feel like sometimes a lot of people don't understand what all is involved. And so not only are we doing cleanings, but the students have to sit for a national written exam, and then they also have to take a clinical exam. And then they have to apply for licensure. And so that's one thing that I like to focus on too, so everybody is aware that, you know, these are educated people that love their profession.
Yeah.
And if anybody's interested in making an appointment, they can call our clinic, or if they're interested in maybe learning more about being a dental hygienist, they can contact our office as well, and then we can sit down and do some advising with anybody that's interested, because we love it.
Well, and I think it shows, which is really exciting, because again, it's one of those fields that, you know, when I thought about it, it entails a lot more. I mean, I have a rudimentary, obviously, knowledge about it, and as an advisor at Georgia Highlands, I felt like I was always, used to feel very confident about doing nursing and dental hygiene along with my human services. I'm not quite as confident because things have changed logistically about, you know, what classes they need when, sequences and stuff. But, you know, always been pretty confident. And the fact, I think it's very good that you bring out the associate level, that it is a highly professional, licensed degree, so that people that may not even realize it's not just a matter of they're a technician, they go in. It's really a real professional degree.
Right, it's a very rigorous program.
I've heard, so, which is good. I mean, if somebody's going to mess in with this mouth, I want them to know what they're doing. So yeah, I think that's really critical to know. Now I may be out of turn, and Are y'all a bachelor's program now too? Are y'all looking at it?
No, we have both. So we have an entry-level associate's degree licensure
what I was
program.
thinking.
And then once you're a licensed professional, then you can come back for our completion program.
That's what I thought. Okay, I thought, okay, you didn't mention that, and I thought, okay, have I forgotten something?
Our bachelor's program is an online program, and it is for the working hygienist who's already out and they want to expand their knowledge or venture out into other aspects of the dental profession. So they can go into public health settings, they can go into governmental settings, and this is not necessarily just cleaning, but working on policy, sales. You know, there are different toothpaste distributors, and they need people that go out and market their materials and understand it from an oral health perspective. Education, a lot of our graduates have gone on to work in some of the college and career academies at the high school level, so that's always we do a lot of collaboration with them and going to the high schools and talking about the profession. So we've seen a lot of our graduates expand into different areas of dental hygiene, so that's kind of exciting.
Yeah, I was thinking, and I just didn't. I thought, well, she didn't mention it, and I hope I wasn't forgetting something.
So at the national level, it's a minimum of an associate's degree. But in the state of Georgia, there are 2 entry-level bachelor's programs. And then the rest, out of the 16 in the state, the other 14 are associate granting institutions.
Okay. But the key to me is going back to with the associate level, that's what you're really doing as the person that's behind the scenes, behind that mask, working on my mouth.
It can be both, but yeah.
But I mean that license,
Yes.
and even if they're in the bachelor's degree, they would have had to have the license first anyway. So.
Absolutely.
The minimum education for entry into the profession is an associate degree to get your licensure.
Yeah.
But continuing on to get the bachelor's degree is always an option.
And it's always, well, as educators, we always feel like that's a good good thing. And so I definitely wanted to highlight that, even though it's not necessarily for the hygienist per se, because they already have their licensure, but it's also to highlight that we do have a bachelor's program, and that, you know, it's well worth their people looking into if that's their field. They might not just be from Georgia Highlands.
No, absolutely.
So, you know, to put the word out there as well that this is an option at Georgia Highlands. So.
Absolutely.
It is. You know, it's an exciting time right now to be a dental hygienist. The profession is growing in respect, and we would certainly welcome the opportunity to speak to anybody that's interested in our program and the profession.
Absolutely, and so I know it makes me more excited. I always, like I said, in advising, I always talk about it. I kind of hit it all, nursing and dental hygiene and human services, but our time is running out. A lot happens when you're having fun, right? It happens fast. But get your coffee, we'll be right back.
Your life is filled with opportunities to show the world you can take charge. It's waking up each day with a mission. It's working each day toward a goal. It's choosing to rise. It's charging forward with a purpose. It's changing the course of your life and taking charge of your future. If you're ready to be a take charger, enroll at Georgia Highlands College today.
Welcome back to GHC Coffee Break. Michelle, real quick, give us the phone number for our clinic here.
Okay, it's 706-295-6760. And that's for any questions related to the clinic or the profession, the program at Georgia Highlands. So.
All right, you heard it. Call. Take care until next time. GHC Coffee Break. Have a good day.